Hi, my name is Nora, and I'm going to be presenting on leprosy. So, what is leprosy? It's also known as Hansen's disease from the person who discovered it. It's a bacterial infection from Mycobacterium leprae. It affects the nerves, eyes, skin, and the lining of the nose. Taxonomy: it belongs to the kingdom bacteria, the phylum Actinomycetoma, the class Actinomycetes, the order Mycobacterialis, the family Mycobacteriaceae, the genus Mycobacterium, and the species is Leprae, which is the most common and well known, and Lepromatosis, which is a second strain that rarely causes leprosy. Some history. Earliest evidence of leprosy was a 14,000-year-old skeleton that was found in 2009 that had signs of leprosy. There was an estimated of 19,000 leprous hospitals across Europe at one point in time. Leprosy begins to disappear in Europe and eventually dying out in most countries around the 1600s. The bacteria that causes leprosy was discovered in Norway, and TLM was set up across Ireland. And the WHO recommends MTD, multi-drug therapy treatment for leprosy. This treatment cures leprosy and cuts transmission. So, a little history on the person that discovered it was Dr. Gerard Amar Hampson, who lived from 1841 to 1912. He was a Norwegian physician who discovered the agent, Mycobacterium leprae. After completing his schooling, he returned to his hometown in Bergen, which is the center of European leprosy research. During his time in Norway, there was a lot of cases, more than any other European country. He began working in a hospital in his hometown and was convinced that leprosy was spread from person to person, while his superior, Dr. Danielson, who he worked under, believed it was hereditary. Hanson's belief was really speculative at the time because something being contagious, spreading from like one person to person, really hadn't been understood at the time, and no one really knew at the time that bacteria could cause disease. Through his research, he discovered the leprous infected the lymph node tissue, and he did not understand what this meant yet, so he decided to go further his education and study histopathology. Upon returning, he used staining methods and biopsy and intensive microscopy worked to identify the causative agent. He then pursued efforts in order to stop the spread of the disease. He believed that isolation of infected individuals was the best way to stop the spread of the disease, and developed a series of laws that would require infected individuals to isolate and not travel to seek aid. So some characteristics, leprosy, the bacteria, Mycobacterium leprae, is a gram-positive and acid-fast. So gram-positive meaning it has a thick layer of peptidoglycan, and acid-fast means that it has mycolic acid making a waxy layer on it, so it is hard to permeate. It is bacillus-shaped, single arrangement, is an obligative intercellular pathogen. It has not been grown in an exonic medium since identified, which means they've only been able to grow it in cells. They've not been able to grow it outside of cells. It has an incubation period of 5 years on average, and it grows slowly. It takes 12.5 days to replicate, and it does prefer to grow in cooler temperatures. So it is transmitted from person to person from droplets from the nose and mouth. In order for this to happen, though, you have to have prolonged contact with the person with untreated leprosy. Casual contact for short periods of times, like hugging and shaking hands, you won't transmit the bacteria. And then once you start treatment, you can no longer spread the disease. So the people who are most at risk, it does affect people of all ages. There's no certain age, like older people or younger people, that can get affected by this. Most common in ages 5 to 15 and individuals over 30. If you have the PARK2 and PARK-RG genes, you are more at risk. If you have contact with the 9-banded armadillo, you are more at risk. If you are in immunosuppressive state, and 95 people infected with leprosy don't actually develop it because their immune system can fight it off. So there's 3 main types of leprosy. We have the tuberculoid, which has a small amount of the M bacteria. That's why it is mild and less severe and less contagious. It has granulomas, red patches with raised borders, loss of sensation, affected nerve cells, and thickened and tender of palpation, which is seen on the top image. Lepromatosis leprosy is extreme and more contagious, swelling and thickening the limbs and poorly defined hyperpigmentation that is seen on the bottom with the man. And borderline leprosy is where in transient multiple lesions of varying size, shape, and distribution, skin colored, and erythritous lesions, which is seen on the bottom with the man on his back showing. Pathogenesis. So the bacteria targets the macrophages in the skin and the Schwann cells in the peripheral nerves. Because the bacteria grows best at low temperatures, that is why it affects the skin, mucous membranes, and the peripheral nerves. Because these areas are the farthest away from the heart, so they are less warm. The bacteria wraps their plasma membranes around the peripheral nerve axon, forming the myelin sheath. When they bind, it induces demyelination, affecting the transmission of electrical impulses through the nerve axon and causing nerve injury. The bacteria, for macrophages, the bacteria gets ingested by macrophages and wrapped up in the phagosome, which would typically merge with the lysosomes to kill the bacteria, but the mycobacteria has the ability to injure the phagosomal fusion, which allows the bacteria to survive and replicate inside the macrophage. So for the skin and mucous membranes, they are discolored skin patches. There's nodules on the skin. The skin gets thickened and dry. Painful ulcers on the soles of the feet. There's painful swelling or lumps on the face or earlobes. Loss of eyebrows and eyelashes, stuffy nose, and nosebleeds. For the nerves, numbness of infected areas, muscle weakness or paralysis. There are enlarged nerves, eye problems that can lead to blindness. And this disease is most dangerous if left untreated. Having leprosy just get infected is not like the worst possible thing, but the worst possible thing is not seeking treatment, because you can have loss of sensation, paralysis and crippling of the hands and feet, shortening of the fingers and toes, chronic non-healing ulcers, blindness, nose disfigurement, burning sensation of the skin, painful or tender nerves, and redness and pain. And the reason that you can lose your fingers and toes is because it affects the nerves and they're not getting like a good blood supply and causes you to lose them because they're not getting enough blood to keep them. So the immune response. So the two main types of the three that I mentioned was the tuberculoid and the lepromatosis. The tuberculoid is cell-mediated immunity. So Th1 cells secrete IL-2, which activates the CTLs, or the cytotoxic T lymphocytes, and it increases the INF-gamma, which activates natural killer cells and macrophages, which produce chemicals to destroy ingested bacteria directly. High cell-mediated response. This works well with the macrophages. And then the Th2 cells secrete IL-4 and 5 and 10, which are B cells that signal B cells to make antibodies against M. leprae, most effective for intracellular pathogens, low cell-mediated response, anti-humoral immunity. So diagnosis. So a biopsy is needed to confirm the diagnosis. Tissue from the affected site show histopathologic changes that show a large number of foam cells, which are macrophages that have ingested phagocytized M. leprae bacteria, but are unable to digest the organisms, who then multiply and use macrophages as a method of transport throughout the body. And this is how the lesions are able to spread. The presence of acid-fast bacilli in the body, because typically your body does not have that. And then Leprumon skin test is where indicated M. leprae is inactivated. M. leprae is injected intradermally, and after 24 hours, if there's an induration, that means there is a cell-mediated response against the bacteria. In the case, the individual would be negative for lepromatosis and positive for the tuberculoid. The reason why the genus Mycobacterium might look familiar is because it is the same as for tuberculosis, which we learned in class. So like if you ever gotten a TB skin test and they inject the fluid, they're looking for that response, which is the same thing they're looking in the Leprosy skin test. Treatment. So there's two main treatments, and they're both a combination of antibiotics. The multi-drug therapy, there is the Bacillary form, which two antibiotics are used at the same time. Daily dapsone is taken, and rifamycin is taken once per month. And the multibacillary form is daily clofamizin added to the bacillary form. Treatment can last 1 to 2 years, and this can be cured if treatment is completed as prescribed. Impairments cannot be reversed though, so like shortening of the limbs, there might be some permanent loss of sensation. That is why treating it as early is important. The antibiotics are used during the treatment will kill the bacteria that cause leprosy, but they do not reverse any of the nerve damage, as I mentioned. And if it is left untreated, there will be severe nerve damage that could cause paralysis and crippling of the hands and feet. Thank you for listening.